Welcome to the Oregon State Board of Nursing presentation on the requirements for worksite monitoring of nurses or nursing assistants on probation or those engaged in the Health Professional Service Program. As the Executive Director, I will be providing the presentation to prepare you for the test to become a monitor. The Oregon State Board of Nursing acknowledges that nurses experience substance use and mental health disorders at rates similar to or higher than the general population. These issues lead to numerous complaints and pose risks to health and safety without proper treatment and monitoring. Addictive, psychiatric, or other potentially impairing disorders may be chronic relapsing conditions, and without appropriate treatment and accountability, individual health and public safety are at risk. The goal of monitoring is to maintain public safety while monitoring participants with substance use and other mental health disorders or practice issues so they may continue to serve the people of Oregon safely. The board policy requires participants to comply with the terms and conditions of their stipulated orders, agreement with HPSP, as well as complying with the Nurse Practice Act. A licensed healthcare professional must complete this training and a post-test to meet board standards. They should understand participant restrictions and have supervisory authority. Typically, the worksite monitor is the direct supervisor, but alternatives can be approved. Secondary monitors may be appointed to cover absences. In most cases, the worksite monitor is the participant's direct supervisor or manager. However, depending on the worksite setting, the compliance specialist or HPSP monitor may approve an alternative relationship. In addition, designees with knowledge of the participant's probation may be appointed as a secondary by the employer to cover when the primary worksite monitor is not available. This presentation covers Oregon Administrative Rule 851-70, also known as Division 70 of the Nurse Practice Act. It outlines the responsibilities of worksite monitors. The board urges all monitors and supervisors to review the entire division before working with someone under monitored practice. A worksite monitor is a licensed healthcare professional who regularly contacts participants in the workplace. They act as a liaison between the employer and the monitoring program. The worksite monitor's role is to observe the participants' adherence to the return to work agreement and assess whether they show any signs of impairment or practice issues in the workplace. A license or certificate holder can return to work under monitored practice in two ways: through board probation or the board's alternative to discipline program, known as Health Professional Service Program. Board probation is a public form of discipline imposed by the board on a licensee or certificate holder. Participants are issued a board order and are required to engage with OSBN's compliance specialists. This ensures that they adhere to the stipulated guidelines and maintain professional standards. The monitoring process involves various methods to ensure compliance and support the participants' return to safe practice at work. The Health Professional Service Program is an alternative to discipline program. Participation is confidential and not disclosed publicly. HPSP can be a self-referral or imposed by the board. HPSP is a consolidated statewide program to assist healthcare providers with substance use disorder or mental health diagnoses, so they may continue to work and care for people safely. Regardless of whether the licensee is on probation or under the alternative to discipline program, the board requires the worksite monitor to observe the licensee or certificate holder for compliance with the return to work agreement, assess for any signs or symptoms of impairment, and evaluate for safe or unsafe practice. For practice probation Unrelated to impairment, the worksite monitor must be another nurse to ensure proper practice. An exception is made for APRNs, advanced practice registered nurses, with prescription authority, allowing physicians to monitor their practice due to the similarity in their roles. Supervision clarifications. A frequently asked question about accepting a worksite monitor assignment is whether the person I monitor works under my license. The answer is no. The licensee works under the requirements of their own license. As a worksite monitor, it's crucial to understand the board's restrictions on a licensee's return to work. These restrictions are detailed in the board order for probation or the return to work agreement for HPSP participants. Common restrictions include no overtime without approval, no floating to another unit, restricted access to controlled substances, and a minimum number of hours worked per week. The board has set work hour limits for participants to reduce stress and aid recovery. Participants are restricted to a full-time equivalent position with limited overtime. Double shifts are prohibited. Compliance specialists may reevaluate overtime restrictions after 6 months. No more than 2 extra shifts per month are allowed. The worksite supervisor must understand and communicate practice restrictions to the work monitor. Participation in HPSP is confidential and should be shared on a need-to-know basis. Supervisors must inform relevant individuals, including the staffing office or off-shift supervisor, about work restrictions. A workplace monitor must meet specific criteria, complete necessary agreements, provide observation, and submit timely reports. For HPSP, a monthly report is required to be submitted to the HPSP monitor. For probation, a quarterly report is required to be submitted to the Oregon State Board of Nursing. Direct observation requirements. The licensee must work in the presence of another licensed healthcare professional who has the relevant clinical competence and is aware of the individual's participation in HPSP or probation. The worksite monitor must work in the same physical location as the participant and be readily available to observe and assist them. They must meet the board standards for a worksite monitor. The primary worksite monitor should be on site for the majority of each shift, more than 50%, and available by phone or other system when not on site. If the primary monitor is unavailable, the board will identify and approve a secondary monitor. As a worksite monitor, your job is to observe and report any signs of impairment. Communicate concerns with the HPSP monitor or OSBN compliance specialist. Remember, your role is to observe, not diagnose. Look for warning signs, persistence, or patterns in 5 key areas. Those 5 key areas are time and attendance, physical appearance, cognitive performance, behavioral observation, and job performance. Attendance issues include excessive sick days, late arrivals, unexcused absences, and leaving early. Some may volunteer for overtime, especially if the workplace is linked to substance use. Note that agreements usually permit limited overtime for mandatory shifts. The individual may exhibit signs and symptoms such as odor of alcohol, dilated constricted pupils, unsteady gait or balance, shakiness. They may show weight changes or experience nausea and vomiting, which could be related to intoxication or withdrawal. They may show problems with concentration or memory, poor attention, and poor judgment, leading to mistakes. The individual might display mood swings, anger, social isolation, hyperactivity, or sedation, frequent breaks or trips to the bathroom or lounges or other areas. Other warning signs include head nodding, slurred speech, sleeping on the job, and difficulties interacting with coworkers. There may be failures to complete work or meet deadlines, with an overall decline in work quality. An increase in complaints from patients and their families could also be noted. Documentation may be incomplete or inaccurate. You may observe excessive waste of narcotics or a pattern of following the waste policy, such as consistently using maximum doses of pain medication, or patient complaints about receiving insufficient pain medication. If you have performance concerns, you are not required to wait until a monitoring report is due. You can contact Oregon State Board of Nursing or Health Professional Service Program promptly. If you are not the manager, notify the manager about your observations. Then inform the agreement monitor or probation monitor at HPSP or OSBN. If you determine the nurse is impaired, immediately remove them from work. In conclusion, both monitoring programs, probation with Oregon State Board of Nursing compliance specialists, and alternative to discipline with Health Professional Service Program support OSBN's mission of protecting the public through regulatory standards and promoting the well-being of nursing professionals. Both programs track participants' progress by supporting them and reinforcing treatment goals. Additionally, both programs report compliance and safety concerns to the board. Again, the Oregon State Board of Nursing promotes public safety and supports the evidence-based monitoring probation programs and alternative to discipline programs. If you have any questions, head to our website for more resources and contact info. Thank you.